Okay, so hormone requirements before surgery. This video is for our male to female patients or transgender women. So what are the requirements? We'll start first of all with top surgery. Strictly speaking, if we're looking at WPATH criteria, there are not really hormone requirements before undergoing this surgery. However, it is strongly recommended that if you want a feminine look and you want a breast augmentation, that you take your hormones first. And do this for at least 1 year. Two very good reasons to do this. Number one, a lot of transgender women will get good breast growth and may not ever want or need a breast augmentation after the hormones have done their job. It takes at least a year for this to happen, sometimes 2 years. And so just give the hormones a chance and wait and see what your breast growth turns out to be. There's a kind of myth out there that you'll be 1 cup size smaller than your close female relatives. Again, I don't necessarily subscribe to this. I've seen a range all over the place. So the second reason to wait at least a year before you have your breast augmentation is oftentimes when you start on the estrogen and the breast tissue starts responding, this can be a little bit painful for some transgender women, and therefore you should really wait before undergoing breast augmentation surgery. So 1 year of hormones is recommended before top surgery. Okay, so bottom surgery. So again, the rule usually is that 1 year of hormones is required before any bottom surgery. There is one exception to this, and that would be in the case of a transgender woman who is not doing well on a testosterone blocker. So an example of this, the most common testosterone blocker used is a medication called spironolactone. Spironolactone is actually a diuretic. Meaning that it does a couple of things. It makes you pee more than usual, and it also drops your blood pressure. So what that can mean is you can develop a condition on it called orthostatic hypotension, and basically that's where you start getting head rushes every time you get up, and it can also make you faint. So in some cases, in discussion with the patient's medical doctor or hormone provider, we've certainly gone ahead and provided an orchiectomy or removal of the testicles. And this is to take away that testosterone. Once the testicles are gone, you no longer have to be on a testosterone blocker. So that is the one exception, really. Again, if you're going through insurance, the insurance companies will want to see at least 1 year on hormones before your bottom surgery. And that's it with regards hormone requirements. Again, to summarize, top surgery, not necessarily, but strongly recommended at least 1 year, sometimes 2 before you've had all your breast growth. And for bottom surgery, at least one year is usually what's required.